Why keep sticking your finger in a light socket? If something isn't working, it's a good time to try something else. A friend came into town and wanted me to look at his shoulder. His orthopedic reviewed his MRI and recommended physical therapy because there wasn't anything to repair surgically. He has gone through 2 months of physical therapy and wasn't getting better. If anything, he was getting a little worse. We reviewed which exercise he was doing and any changes made. A few weeks ago, they started adding some more exercises above his head and increased the weights. When I asked if this made it better, he said, no, it probably made it worse. We reviewed all the exercises he started with and how he progressed and changed over the last 2 months. There was nothing wrong with how they started the treatment plan or exercises. The problem became when he wasn't improving on plan A, they kept going with plan A. When that didn't work, they doubled down on plan A exercises with more weight and more reps above his head. They increased the above the head weights and exercises because they said he needs to start making progress, so we're going to force it. They just kept having him stick his finger in the light socket and then increase the voltage to see if anything different would happen. We've seen this too many times before where people aren't improving with activities and exercises, but instead are entering a pain zone and aggravating their condition rather than improving it. Treatment involves shifting those exercises to a level where they can be performed without pain, allowing them to make progress in a pain-free manner. As they improve, we can increase the stress load, weight, or band resistance in the pain-free zone. With progress, we can begin to move that hand up towards the head and eventually overhead. If the exercise and stretching plan were going to work, it would have worked by now. More importantly, he needs a shift in strategy. His current facility doesn't do any soft tissue treatments, so massage, manual therapy, Graston Technique, or Shockwave Therapy were not performed. This is one of those shoulders that won't improve with just exercises and stretches. We use Shockwave Therapy and the Graston Technique to help stimulate tendon repair cells, break up scar tissue, and enhance the healing of his chronic tendinosis. After one visit with Shockwave and Graston, his morning shoulder pain had decreased. He had noticeably improved pain-free motion, and his shoulder loosened up more quickly with his new morning exercises that I had given him. I found exercises with the same goals, but he could do them without pain or aggravating his shoulder. Every office has different tools in its toolbox. His current office doesn't have any soft tissue treatments in its toolbox. It may not be the right facility for him. He needs somebody to work the soft tissues with an aggressive manner with Graston or Shockwave. I gave him a copy of my shoulder book, which included a plan of progressive exercises that he could perform. He found the section on chronic tendonitis and soft tissue healing helpful, and it helped him better understand his injury. To learn more about shoulder injury treatment options, especially for chronic shoulder pain that isn't improving, get a copy of my book in the office or on Amazon.